Hello everyone, my name is Ranshua Marie Mayangitan from Candaba, Pampanga. I am a model, a beauty queen, and a medical doctor. I learned about CSA Aesthetics because of its platform in providing high-quality aesthetic services and innovative treatments. Actually, nakilala ko po si Dr. Contessa way back years ago noong isa siya sa mga sponsors namin doon sa beauty pageant na sinalihan ko. So, when I have learned na I have this condition called hyperhidrosis, siya talaga yung una kong naisip. So, hindi ako naging hesitant na mag-inquire sa skin clinic nila, and now I am here. Don't forget to click the subscribe button and the notification bell of the YouTube channel of CSA Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest, a licensed physician. Let's all welcome Dr. Ranch.
Hi,
Doctora is in mid-20s or?
I'm already 29.
Oh, you look younger. Yan. So, Doctora was with us last time, and we did a treatment for the so-called hyperhidrosis, particularly on the forehead region. We just did one-time treatment for that one, and this is the best time to do it like a follow-up, okay? And for that one, we do a kind of diagnostic, which is what we call the iodine test, starch iodine test. And the result, yan, di ba? You have seen parang yung turn of the color into like a black color there. So the areas with the black color, it means to say you have active sweat glands in those areas. And our mode of treatment is with our botulinum toxin. And apart from treating the so-called hyperhidrosis, of course, we'll work on the full face area. Assessment is important, so you check on the upper third, so no wrinkles, yan. So the upper third is very good. And when you look at the eyes, when you smile, you may see a little bit of some dynamic lines there. And then the mid-face section, okay, you look at the profile view. So good nose profile, good cheek profile. There's a good projection there, or positive vector, or the OG curve. And then when you go at the lower face, I just noticed on lower face some asymmetry, okay? And I palpated the masseter, and the right side is stronger than the left. That's why kind of you have a dominance on the right side also. And we're checking on the line here. So far, she's young. Okay, so it's good. But a little bit of some, because of course, you're still in your 20s. Okay, so some baby fats there. So some what we call jowl fats here, jowl fats there. But the chin is good, and the under chin is awesome. Sexy area there. Okay, and quality of the skin, you can also check like in the mid-face section. Of course, when you were in teenage years, you experienced acne problem, okay? And the acne gave souvenirs, acne marks, okay? Or some of the shallow acne marks there that we see here on the cheek area, lateral cheek area, and on the opposite side. So more on this side, more on the right side. And some of the blemishes or the pigmentations from like previous acne. You're still in your 20s, so you may still experience some so-called like hormonal acne, okay, and some active sebaceous glands there. So you notice in your T-zone area, active sebaceous glands. And then on the mid-cheek region, you'll notice open pores, enlarged pores. So we'll do some treatment for those areas there. And apart from the face region, we were also discussing a while ago about parts of the body where we have concerns. So Dr. Ranch mentioned about like this shoulder part here. So you're in like you're joining a beauty pageant, so you're wearing, of course there's like a portion there like the swimsuit portion there. and maybe you're noticing, or you're wearing a gown that could be, you know, off shoulder, like that. So you're noticing bulges on the shoulder area. And actually, I palpated this side here, and it's kind of spastic, okay, tense. Yan. Does it hurt when I press on it? Not really.
Not really.
Yeah, okay. So we want to do some relaxation treatment on that one, okay? And previously, we've done already like an episode on what we call TRAPTOX. So we inject a botulinum toxin to relax the muscle so you don't have that kind of discomfort there. And another thing that Doctora mentioned is like on the lower extremities. So we have the so-called calves there. Okay, what do you call the muscle? Dun sa area? Gastrocnemius muscle. Yan, si Doctora, alam niya yan. So, like, of course, women, we wanted to kind of have slimmer legs, the lower extremities, right? But if the gastrocnemius muscle is kind of also like hypertrophied, or like the muscle mass is, I don't want to say huge or massive, or kind of like we want to reduce a bit the size, okay, to really make it like more of a slimmer, or of course the feminine one, okay? Probably you're active or you're doing some sports.
Yes po.
Yeah, for ladies who are into, even some of the swimmers, okay? So you'll notice their shoulders are kind of broad also, and then of course their arm muscles are kind of also bigger. And then probably some activities on lower extremities that made your gastrocnemius kind of hypertrophied, or the muscles always contracting, some activities there, okay? So we can do a treatment for that one too, because it's a concern, of course, when you're into beauty pageants. They look at from head to foot, right? So it's like all over, and they check on all parts of your body, okay? Hindi lang head, hindi lang face. So we want to work on the body, okay? What kind of treatment, what procedure, we will show you when we return. And we're back. So we'll do some treatments for Dr. Ranch. And I'm checking on her skin. Actually, the mid-face section, I am looking at the right side here. So we notice some of the acne marks here. So a little bit kind of depressed, okay, on this part here. Now on the left side, not so much, but you'll see some of the kind of, a little bit of some dark spots there, right? So we want to balance the skin tone as well. And then the area here, some open pores. Okay, and on the chin region, some of the, also a little bit of your pimple marks. Okay, especially this one too. So I'll start with a treatment called Eladerm, and Eladerm is our radiofrequency microneedling device. So this one, and this one is like a dual frequency one. We have a 1 and 2 megahertz that we're gonna use for Dr. Ranch here. It can target a shallow kind of the acne marks, and if you still want to go somehow deeper also to rejuvenate the skin and stimulate collagen there, we can use both these frequencies here, okay? So we're using these kinds of parameters here. We have the power, the depth, the duration, and also it has this cryo spray whereby it will help in minimizing any discomfort there. So, okay, since the problem mainly is on the mid face to the lower face, the upper third is more of the hyperhidrosis here, okay? So we'll start working on I can start working on the lower face. So it's not going to be the usual one that I do, that I start on the forehead. This time I start on the chin area, okay? So first one, so you felt the cold spray, right? So that's the cryogen spray, okay? So we'll just continue with this one. Then after doing this, we'll apply the so-called skin boosters. We have different kinds of skin boosters here, depending on the skin condition. Okay, I can also combine with my pain freeze, and then here you go. So Dr. Ranch, we have different kinds of skin boosters depending on the skin type, the skin condition. We have a skin booster that's indicated for those acne problems, or those kinds of sensitive skin, dry skin, oily skin, aging skin like me. So we have different kinds of skin boosters. So depending on the kind of the skin analysis that we have done, then we will apply the same kind of that skin booster needed by the skin. Now, Doctora has kind of like a combination type of your skin, right? So the T-zone, as you notice, you have like active glands there. So the T-zone usually is what we call the oily area. And then the other parts of the face, it could either be like a dry type or just a normal skin type, okay? So you know, Doctora, how to determine if your skin is oily, your skin is dry, your skin is sensitive. Definitely, you know your skin is aging when you see lines and wrinkles, right?
Yes.
Like mine. Yeah. So Doctora is combination, okay? So some of our patients here, they actually report to us some sensitivity of their skin because they tend to have redness whenever they do. For example, they apply some topical, for example, tretinoin. You know tretinoin? It's the gold standard treatment for acne problems. Okay, some of my patients, they report to me, doctor, I react with the tretinoin. They report some irritant dermatitis. So what we tell them is to like reduce the concentration of your tretinoin or like use a non-irritating type of a medicine. For example, we have those adapalene for acne problems. So, doctor, you still experience acne?
Yes po, kapag malapit na yung menstruation.
Yeah,
ganun,
especially
or
for
kapag
women.
super stressed.
Yeah, because of the cycle, the hormonal cycle, we get some acne. And because you still develop acne, you notice you still have some acne marks, right?
Yes.
Yeah. So, whenever you have acne, what kind of acne do you notice? Is it the one with the pus or a big one or cystic one?
The cystic one po, Doc.
Yeah, that's why I noticed you develop those marks there. So since Doctora's skin is just still a beautiful skin, so the treatment that I'm doing for her is more of like just to improve those acne marks and still improve the quality of the skin, rejuvenate the skin as well, and also the large pores there. Okay, so we'll prepare with our skin boosters. Usually when I do combination procedures, I start with devices first before doing any injections, okay? So we have skin boosters that we just infuse after microneedling. We just apply it. It's a so-called like a topical application. So after this, Doctora, you'll also come back for Eladerm to do another session of this one, okay? So this is like a quick treatment, lunchtime treatment. Since Doctora is still working in the clinic, so you can come out from your clinic and do this. It's just a quick treatment. Okay. And then you need a very good post skincare. So the quality of your skincare is also significant. It's going to help in the improvement of the skin texture, skin quality. So we want you to be your best during that competition, right? Is it going to be in a month or two?
Yes, after a month on January 2020.
Wow.
No final date yet.
Okay. So we really need to prepare you physically. You're prepared mentally?
Yes, I am prepared mentally.
Oh, that's good. Yeah. You rock it when it comes to the Q&A. Yeah. Sample nga, Doc. Sample of the Q&A. Okay. So I'll also work on the skin of the nose area. I'm checking on Doctora's skin on the nose area. So we notice a little bit of those kind of tiny marks there or pitted marks there. So we also wanted to improve the skin here. So she has some oiliness on this part there, okay? So we'll just infuse already the skin boosters. Then after that, I'll work on the forehead area. We did an iodine starch test a while ago. So we'll just apply this. So this is a good topical for cases who wanted to kind of still improve their skin quality, skin texture, overall skin tone. So we have a combination of this one. We have the brightening, we have the anti-inflammatory, anti-redness, anti-aging. Also for those with dry skin and also those with sensitive skin, we can use this kind of skin booster. Okay. How does it feel, Doctora?
Parang medyo malambig po.
Yeah. So now we'll proceed with the so-called Mesotox for the treatment of our hyperhidrosis on the forehead region. So hyperhidrosis is defined as excessive sweating. Okay, so we have active sweat glands, and most of the time what we do is like we assess it first. We have to delineate where the areas are, and on you, Doctora, it's kind of like more of this upper part of your forehead region. And I have a botulinum toxin here. And the dose that we use is a hyperdiluted one. So we have the hyperdiluted type of botulinum toxin, and we inject it intradermally. Okay, so we'll focus on this region here and this region here. Okay, so in the area, please disinfect, and you can apply your pain freeze, please. And I'll still give additional like toxin injections for Dr. Ranch. Like the masseter here is dominant, and then we also need to balance with the left masseter. Okay, so I had cases whereby they asked me, Doc, if I have only one side is bigger than the other side, will you also treat the other side? What do you think is the answer, Doctora?
If mas malaki yung other side, yun po yung magiging focus.
Yes, that's the focus. But don't forget the muscle on the other side. You don't want the muscle to kind of compensate. So it's also called what we call yung parang hyperfunction on the other side. So we want to focus. For example, this is bigger. Focus here. So more or higher dose. And then you just give like a low dose on one side. Yon. Because the muscle here will compensate. So next time it's gonna be the bigger muscle. So you do balance also, preventing the hyperfunction effect on the other side. Okay? So yun. Trivia. Right? Because some patients are asking me that, do you do like one side only? I recommend doing a low dose on the other side. So this is just injecting the one with the hyperhidrosis. And usually the onset of action of these toxins, botulinum toxins, according to studies, they said that day 3 is the onset of action, and the effect will last, or rather, you'll still see more action up to 15 days. And as to how long it will last, so it's like they would say it could be 3 months, 4 months, 5 months, 6 months. So it varies among different people, among individuals, okay? And your toxin, again, it's not only for your hyperhidrosis. Of course, we treat it with those wrinkles, right, lines, yeah. So we've done the forehead. Let me just do a little bit on the cheek area. This is to also reduce oiliness in that area, at the same time close your pores. So this is just like a small injections. So we're just creating the so-called bleb technique. Bleb technique lang do. Or sometimes we just apply the toxin in those areas where we had done like microneedling. And then after this, we'll do some masseter tox or Jawtox. Have you experienced Jawtox, Doctora?
Not yet po, ngayon pa lang.
Okay. So just a little bit, since it's your first time, I can inject like, for example, like 20 units here. Then we can inject like a few units here, like 5 units lang there, okay? So just a little bit more. And then we'll do the opposite side. So again, this is Mesotox using hyper diluted dose. So you don't need large doses here. And the layer is just intradermal. You don't need to go to those muscle layers. You don't want to paralyze your smiling muscles, okay? So just a reminder to all of us. Okay. So we'll do the Jawtox here. Like I can use a 20 unit there. So bite, Doctora. Then palpate for the anterior border. We avoid the 1 cm line there. Okay. And then we'll proceed to the other side. And then once we've done this, we will also be adding like TRAPTOX. So TRAPTOX is injecting trapezius muscle. Okay. So a little bit on the left. Okay. So we're done with the face. So we'll be assessing the trapezius muscle here. So on this part here, you can palpate it, and also, yeah, you can feel for the tension of the muscle there, so we can subdivide the area. We'll just be working on the muscle that has the most of that tension there, okay, and we can subdivide this. And basically, this is the area where Doctora has this kind of bulge. If you're looking at the frontal view, you'll notice like a bulge on your shoulder, especially this one. This is very noticeable bulge on the left side here. Okay. So we'll just subdivide that. So this is our area for injection, okay? So we'll be disinfecting the area. Okay. So I'll be changing my gloves. And as to the number of units, okay, for every injection points, I can give like 5 units for every injection point. And this is just gonna be a quick one. So intramuscular layer there. Okay. So just inside those squares that we have marked. And you're okay, Doctor? Yeah. So usually, the next day you'll already feel like there's gonna be a relief in your tension already. Okay. And let's do the other side. So we're proceeding to the gastrocnemius muscles. Okay, so noticeable a bulge here. So we want to make the marking of the bulge. We're going to focus on this area here. Same thing on the other side. Okay, so we need something that's gonna, so it's wet. That's why it's not really stained. We want something that's gonna stay the marking. So you'll palpate for the muscle that bulges. So we can work on that. And it's Doctor's first time to do this, so we'll be starting with some minimum doses. Like in one area, you can work with 50 units per side, depending on how huge the muscle is. So we can subdivide it again like this. So make your squares again and inject inside those squares. So it's just subdividing the areas where we will work on. Okay. So we can see also some of her reticular veins, no, Doctora? Yes. So she can have also a so-called sclerotherapy, okay? So this is intramuscular again. So you need to add some more. Aspirate some more. And then we're just working inside those squares. Then usually we ask them to come back after like 2 weeks so we can re-evaluate. Sorry. Did that hurt? Yeah, because there was a contraction that happened there. Okay, so last one and we're almost done. And after this, we'll show the result to Dr. Ranch. Okay, she has a red face already because of the RF microneedling that we did on her. Okay, there you go. So, we have done several procedures for Dr. Ranch. Okay, on the face area, we did a combination Eladerm together with some of our Mesotox. We did also some Jawtox there, TRAPTOX and CALFTOX. Then we'll show the result when we return. And we're back, so let's show the result to Dr. Ranch. Doctor, after doing those multiple treatments on you, so you can check on your face right now. So it's expected that you have some erythema from that RF microneedling. We just focused on the mid-face and the lower face. We also did treatment of the so-called hyperhidrosis on your forehead region. We made use of the so-called technique like Mesotox. So it's injecting intradermally. And then we also added like Jawtox there. But we also did Mesotox on the mid-face section to tighten the skin, close the pores, and reduce the redness. And at the same time, you know, make those acne glands also be, you know, there's a contraction of those acne glands. There were studies supporting those kinds of therapy for oiliness, acne, rosacea, also the activity of the sweat gland. So there are studies that they have shown that it works for those cases. Okay, and then also on the shoulder, TRAPTOX, targeting the trapezius muscle. And then also on the lower extremities, the leg area, the posterior aspect there, the so-called CALFTOX. Yeah. Actually, botulinum toxin, it has several applications or uses. It's not only for like cosmetic or wrinkle treatment or beautification or anti-aging, but it has medical or other therapeutic uses. Actually, they use it for like blepharospasm, hemifacial spasm, some kind of those like neurologic conditions and also ophthalmologic conditions. It was originally for those therapeutic indications. It was not even for cosmetic uses before. Okay. So, how was it, Doc Ranch?
It
Yeah.
feels great po na
Yeah.
yung mga concerns ko, it will na-address na po lahat.
Exactly.
Thank you so much.
Yeah, we'll still do a follow-up for her, and we'll check on the symmetry. We've mentioned that the right masseter muscle is dominant than the left. Yon. Is it because you're chewing more on the right side?
I think so.
Yeah, it could be that, or it could be just a genetic thing. You know, you were born with it. Okay. So what we're doing is to balance that one, and also I'm checking on your temple region. You may need some volume restoration there in the form of like a filler injection. You have a good forehead projection. I like it, and even the cheek projection. And then the nose is so natural, so beautiful. And I'm also checking on the lip area, some asymmetry there. I noticed that this right side is wider than the left side. So we'll still do some, you know, balancing treatment for Dr. Ranch before her big day, that beauty pageant. Okay? So we'll take some photos of the, like, after a week, after 2 weeks, we will follow you. Do you have any social media?
Yes,
we can follow you, yeah.
Yes, you can follow me on my Instagram account, RanchiMarieMD, and you can also follow me on my Facebook. My account name is Ranchua Mayangitan.
There you go. If you need consultation, go to ano clinic.
You can message me first via
Yeah.
my Facebook Messenger.
There you go. You can also follow us at our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. If you have any questions, email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And our other videos, please watch them in our YouTube channel, Contessa Salvador. And we'll see more of Dr. Ranch. We'll follow you. God bless you. Thank you so much for joining us in our episode today. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.